Good morning, everyone. It's a great pleasure to be with you today to talk about CDC's role in supporting the people of Central Asia in combating COVID-19. CDC opened its first office in Central Asia 25 years ago. Today, we have staff in over 50 countries worldwide, including Kazakhstan, Kyrgyzstan, Tajikistan, and Uzbekistan. We also offer assistance when requested to the Ministry of Health in Turkmenistan. Unlike other binational programs, we are not a development or assistance organization. We are a health agency staffed by epidemiologists, laboratory specialists, and other public health experts. Our purpose is to partner with ministries of health to advance health science and develop programs that prevent, detect, and respond to disease. The reason the US sees this as a worthwhile investment is now painfully obvious, because diseases, especially infectious diseases, spread globally faster than ever. Our support to this region is not just an investment in the health of those nations, it's an investment in the health of America and the whole world. Since the beginning of the COVID-19 outbreak, CDC has offered our technical expertise to governments in Central Asia. We've provided advice and collaborated with ministries of health on epidemiological analysis in areas such as hospital infection control, case tracking, hotspot analysis, and epidemic modeling. The early response of countries in the region to COVID-19, including the closing of businesses and restrictions on movement, has slowed the spread of the virus. We are now pioneering the use of public data sources that track the mobility of people to monitor the lifting of those restrictions and anticipate any resurgence of COVID-19. Recently, we announced an initial commitment of $6.8 million that CDC is providing over the next 2 years to support the ministries of health in Central Asia in protecting their country's citizens and conquering the pandemic. This is on top of the millions that have been allocated through USAID and other government agencies to COVID-19 response in the region. Our CDC offices in each country are now working with the ministries of health to finalize our plans. We are purchasing millions of dollars of supplies for national laboratories to expand their ability to test for COVID-19. We are building public health emergency operations centers and providing equipment and advanced training to monitor the health of people arriving at borders and ports of entry. The trainings we are providing and the collaboration in COVID surveillance and epidemiology is built on the Central Asia Field Epidemiology and Training Program, of which we're very proud. This CDC program provides advanced skills in applied public health to specialists who already work for the Ministry of Health. Since 2003, more than 115 Central Asian nationals have graduated from this program and gone on to lead outbreak investigations and take public health leadership roles in their countries. Their training and our long-standing partnerships in emerging infections, HIV surveillance, and laboratory science are being leveraged to monitor the spread of COVID-19 and devise more effective response measures. We know this will be a long fight, and we are preparing an additional request for funding from our headquarters to be able to expand our support to in addition to the funds that have already been committed. We're at a rare moment in history when the attention of the world turns to a health challenge. All countries, including the United States, are now struggling to minimize the impact of the virus while also trying to minimize the impact on their economies. As we move forward, it's more important than ever that we work in solidarity, sharing information, supporting each other, and working under the principles of global health security to make science-based decisions that will help us defeat this disease with the minimum loss of human lives. CDC has had productive collaborations with these countries for many years, and the CDC office in Central Asia, our headquarters in Atlanta, and all of our country offices stand ready to expand these partnerships to address this new threat. Thank you.